Hello. Hey everyone, good day to all. Myself Dr. Ajay Maurya. Today in this session, I'm going to talk about the ABG interpretation, that is the arterial blood gas analysis. So for the PDF, we have the link in the description. Okay, please get the PDF from the link in the description. So guys, so why we are going to do the ABG analysis? Because to know the how much the bicarb, how much the CO2, how much the oxygen saturation in the our blood in the arterial blood. So we have to monitor the acid base balances, okay, in the patients. So before performing the arterial blood gas before collecting the sample gas, we must do the Allen test. Allen test is done before collecting the sample, because in the emergency setting, guys, we are unable to perform the Allen test in the emergency. Actually, we have to perform this one. So I think everyone knows about this one, Allen test. And okay, what anticoagulant we are going to use is the heparin. You have to do the first of all, you have to take the insulin syringe. Okay, insulin syringe, you have to just take 1 ml of the heparin and just push it back. Okay, give it a wash, and you have to put the wrist at the external position and take the you have to put the syringe at a 45-degree. Okay, so no need to read these guys. Okay, I think everyone knows about this one. But our main motto is that how we are going to interpret in the exam point of view. If they are going to ask about the they will give all the values and you have to interpret. Okay, first of all, to interpret ABG, guys, you must have to know about the all the normal values. First example, we have to know about the what is the normal pH of the blood. It is the 3.52, 3.52, 7.45. How much was 7.35 to 7.45. So this is the pH scale. pH scale, okay, na? How much la? 7.35 to 7.45 is the normal pH of the blood. Okay. If it is, suppose example, if it is more than 7.45. Okay, if it is more than 7.45, that it is a alkaline at base. It will be basic. It will be alkalosis. If it is less than 7.35, then it is a acidosis. Okay. Okay, now 7.45, more than 7.45, it is the acidosis. It is the alkalosis. If it is less than 7.35, then it is the acidosis. Okay, and guys, in order to maintain this blood pH 7.35 to 7.45, God has given this job to lung and the kidney. To lungs and the kidney. So these lungs and kidneys are working working like a brothers in order to maintain their father. Okay, BP, pH. Okay, remember, okay, lungs and kidney are working hard to maintain the pH 7.35 to 7.45. How they are going to maintain? By compensation. Okay, so we are having the respiratory component and the metabolic component. Respiratory component, that is CO2. CO2 means what? Here CO2 will take care by the lungs, and metabolic, the bicarbonate, it will take care by the kidney. Okay, so CO2, if what is normal value, it is the 35 to 45 mmHg. Okay, na? Normally it's the 35 to 45. Remember, just from the 7.35 to just remove 7, here 7, it will be 35 to 45. And about the bicarbonates, it will take care by the what? Kidney. Hence, see, respiratory CO2 means what? It is a respiratory component, and bicarbonate is the metabolic component. Okay, it is the metabolic component. Metabolic component is the bicarbonate. So normal value is the 22 to 28. Some says 22 to 26 also. Okay, so guys, remember here, what if the CO2 level, CO2 is more than 45. Okay, just more than 45 means what, right? If there is, see, CO2 is acidic only. Okay, na? CO2 is acidic and bicarbonate is the basic. Okay, isn't it? So CO2 is a acidic, bicarbonate is the basic. Okay, if there is a CO2 is what acidic. If there is more CO2, if there is more CO2, it means what? It's going to what? Acidosis. If there is more CO2, it means what? It will going to more acidic. Less CO2, it means it will go and it will end up into alkalosis. And see here, bicarb is a basic. Bicarb is a basic. If there is more base, if there is more base, then it will land up into alkalosis. If there is less base, less bicarbs, then it will land up into acidosis. Okay, see here, CO2 is water, CO2 is a acidic. If there is more CO2, it means it will land up into acidosis. Less CO2, alkalosis. Bicarb is a basic. It is a base. If there is more base, it means there is more base. It means water. It will land up into alkalosis. It will less base. It means it will land up into acidosis. Since CO2 is a respiratory content, CO2 is a respiratory content. So how to say it is a respiratory acidosis, respiratory alkalosis. And bicarb is a metabolic component. So if there is a more base, it means it is the metabolic alkalosis. Less base, metabolic acidosis. Let's have a look here. Can you try to answer this one? See here, see here, if the CO2 is 60, it means there is more pressure. It means there is more number of CO2. It means the normal value how much? 35 to 45 here, but it is just 60. There is more CO2. It means water. It's going to the acidosis. What acidosis is metabolic or respiratory? It is the respiratory. Next coming here, bicarb is 35. Oh my God, what is the normal level here? 22 to 28. So base is more. There is more base. Okay, so there is more base. So there is more base. Then what is called? What is called as? It is the alkalosis. What alkalosis? It is the metabolic. It is a metabolic alkalosis. Okay, metabolic alkalosis. Okay, then coming here, PCO2 is 18. Means less CO2. Less CO2. It means guys is coming to the alkalosis. What alkalosis? It is metabolic or a respiratory. CO2 is respiratory. So it is the respiratory respiratory alkalosis. Isn't it? Then coming here. See HCO2 bicarb. Bicarb is 18. What is the normal value? 22 to 28. If there is less base, then it is land up into acidosis. What acidosis? Bicarb is respiratory or metabolic? It is metabolic. So it is a metabolic. So it is a metabolic. Metabolic. It is a metabolic. What acidosis? Okay, done. Are you okay? Are you okay? So next one. Let's see about this. How we are going to say that it is a compensated or uncompensated or partially compensated. So guys here the kidney and the lungs are compensating each other, helping each other. How they are helping each other? Please study this one. Okay now. Okay. See here guys. Here they so this is the king. Suppose example, this is the king. You have to maintain the moods of the king. Okay, if the king has bad mood, that is the ph will be abnormal, Then guys, if the pH of the blood is abnormal, then if only one component is abnormal and other is normal, okay, only one component, it means what? Suppose take example, this is the kidney, and this is the lung. They knows that pH is abnormal. Then only kidney is working hard, but this fellow lung is not working. Simply is normal. Simply his values are normal, but kidney is working hard to maintain the pH. Then it is called the uncompensated. It's not compensated now. Compensated means what? The pH will be normal, but here pH is abnormal, and only one component means only one guy is working here. But this guy is simply sitting. No effect on that. So it is called uncompensated. Okay, if the pH is abnormal, only kidney or lung. See, only one guy is working hard to maintain the pH, to push back the pH as to normal. But this guy, another guy is not working hard. He's not simply sitting. It is called the uncompensated. So you have to see in the options, like if the pH is abnormal and one component is also abnormal and one is just sitting, it's normal. It is the what? It is the uncompensated. Okay, and then this is the one condition. Okay, this is the second condition, remember here. See, and also if the pH is abnormal, okay na, if the pH is abnormal, the king is very sad. To make the king happier, these two guys are working hard. It means two components are changing, means they are not normal. They are compensating by increasing or decreasing. The CO2 or the his bicops. It means both are working hard to maintain the pH of the blood. Okay, it means here the pH is also abnormal, and these two guys values are also abnormal. It means nothing is normal. It is water. It is partially compensated. It means water. It means these two guys are working hard to maintain the pH, but still the pH is not coming to normal. Meaning, if you study hard, suppose example, if you're preparing for the Fmge, you studied a lot for the Fmge. You covered all the topics, you did many grand tests, but still you fail, because uh, but still you fail, means you worked hard, but still you fail. It means you did some part of you did a great job, like 75%. Okay, see here, these two guys working hard, but still they are not keep the pH is normal. So meaning they are still doing the good job only. That's why it's the only partially, no result, only moderate work. See here, okay now. Partially means what? Okay, thoda thoda. It means these two guys are working hard, but still pH is not normal. That is the partially compensated. Next one is if the pH is normal. So if the king mood is normal, it means what? See, king is simply sitting in the hall and he is happy with their clients. What is the behind the scene? Okay, what is the BTS behind the happiness of the king? Because his workers are doing well. Okay, his workers are did well. It means the pH will be normal, but these two guys are working hard. They're changing. It means the values are changing. It It means they are compensating each other in order to maintain the pH level of the blood. So these two values will be different. With these two values will be changing. It means the pH normal is the pH only the normal. Okay now. So I think this is the perfect example of a big uh, oldest like youngest okay, the big brother of the family. Okay now, the first child of the family. The first child of the family is like a wall. He will keep all them happy, but backside there is many what injuries. Okay, he's like a dad. He will make us happy. Okay, so pH will be normal, and these two guys are changing. Because of the changing, the pH will be normal. Okay, okay now. So let's see here. Let's do an exercise here. Interpret the following arterial blood gas. Okay, okay. See here. First of all, you have to check the pH. Okay, always remember you have to check the pH. Okay, so given here the pH is 7.60. In the examination they are not going to give these values. You have to know. Okay, so here the pH of the blood is how much? 7.60. It means what? High or low? What is the normal? 7.35 to 7.45. It is high. Okay, it means high. It means what? This is going to be what? Alkalosis. Isn't it? 7 point. See, pH wise is if it is 7 point, if it is what? See here, the pH is what? So it is given 7.60. It means what is going to be land up into alkalosis. What am I? Alkalosis. So remember it is a alkalosis. Okay. Next, remember the CO2. Partial pressure of CO2 is what? 25. It means what's the normal here? 35 to 45. There is less CO2. CO2 is acidic. Okay, if CO2 is more, then it is acidic. It is less, then it is alkalosis. So the CO2 is here. Here what am 25 only. It is called it will be alkalosis. Is it metabolic or respiratory? It obviously is the CO2 component, that is the respiratory. HCO3 is a what? Normal here. See here, this is the case of the first one. It means meaning the pH is abnormal. The pH is abnormal. But the lung is doing work. The lung is doing the work. The lung is doing the work here. But kidney is simply sitting, simply normal here. Simply is he is simply normal. Then it is called as uncompensated. See here, uncompensated. We have two options here. Uncompensated. What is this? So uncompensated. Here the respiratory here. So uncompensated respiratory alkalosis is the correct answer. Next solve another question. Suppose example, take this one. Okay, third one. Interpret the arterial blood gas. Please try to answer this one. See the pH is water 7.37. Okay, so pH is 7.37. Okay, 7.37. Okay, this is normal. Oh my God, the king mood is very happy because the king mood is very happy. The pH is very happy. Okay, blood happy. Okay, I got my pH back. But what is the BTS behind that? What is the happiness behind that? Because it is CO2 and bicarbonates are working very harder. They're changing. So it is see PCO2 is 76. Oh my god, this is high. This is also high. It means what? This is the third scenario. It is compensated. It means these two guys are working hard so that pH is compensated. So pH is what? Normal. It means they both are compensated each other. See here, nothing is normal here. Didn't it here? Nothing is normal here. Sorry. Okay. See, only see here, only pH is normal here. It means pH is normal. The king is mood is good because of the his workers are working hard. That is CO2 is more and HCO3 more. So it is going to be what? Compensated. So remember, if the pH is normal, then you have to check you have to check the option. It will be must be compensated. So we have two options here: compensated. Let's see. The CO2, how much are 76? CO2 is 76 and HCO3 is 40. Bicarb is 40. Bicarb is 40. Okay, remember. Here we are having the respiratory acidosis and and here in the metabolic alkalosis here. Okay, metabolic alkalosis. So just remember, we have to what you have to do is that it normal is the 7.45 to 7.35 to 7.45. Here normal is the 7. Here 22 28. Which is more here? Okay, which value is more here? Which value is more here? It is only 12. Here is difference is only 12. Here how much the? It's more than how much it will be 45, 55, 65, 75. It is the almost 28, almost 28. It means it the it means CO2 is more to compensate. That's why the here the answer will be what? Answer will be compensated respiratory acidosis is the correct answer. Okay, it means lung is working hard to maintain the than the CO2 than the bicarb, which is the respiratory. Let's interpret this one, guys. pH is what? 7.30. First of all, check 7.30. Is normal? No. It means what? Right? Is the 7.30 is not normal. So it is the 7. It is below 7.35. That is, it will land up into acidosis. Okay. Then PCO2 how much? 60. 60 means what? If the CO2 is what? 60. It means more than 45. CO2 is acidic. It is the what? It will be acidosis. What? It is also acidosis. Okay. And here guys, see, HCO3 is 30. HCO3 also 30. It means, see here, these three values are normal. Among the three values, if there is anything is normal, no. If it is not normal, see, this is the case of this one. I told that if the pH is abnormal and both values are changing and both guys are working hard here. See here, pH is abnormal, but these both guys are working hard here. So it is a partially. So you have to check the options. But partially, it means these three values are not normal. Both are not normal. It is three are not normal. It is the partially compensated. Okay, by the option it is saying, oh, respiratory acidosis. So by the option itself we have to take, okay, respiratory acidosis here. How you are going to tell? Because CO2 is how much? Is 35 to C 35 40 45. It means here it will more than 15 times. But see here, bicarb is only 30 only. It means it is only increased by 2. But the more, which one? CO2 here. It is a respiratory acidosis. Okay. Then please try to. This is your job to do. This is the real. These are the real patient reports. Okay. Please try to solve it and try to comment in the comment box. Okay. Thank you very much, guys, for for this. Please try to listen carefully and try to solve these questions. No need to remember all these things, guys. Just remember the normal value and this trick. Okay, we'll get the easily. Okay, thank you very much. Bye bye.